If you've ever stared at a massive block of text detailing electrolyte imbalances and literally felt your eyes glaze over, you are absolutely in the right place. Today, we're taking raw clinical data on hypokalemia and transforming it into a clean, unforgettable visual map.
So think about it. How are you currently memorizing the causes of hypokalemia? Brute force? Flashcards that you inevitably forget a week later? To solve the massive headache of memorizing endless lists of medical causes, we're going to build a mental map that cuts your cognitive load right in half. We aren't just reciting facts today, we're building a framework in your mind so that when you see low potassium on a chart, your brain instantly knows exactly which path to walk down.
Here is our roadmap for today. First, the blood pressure divide. Next, high BP and hypokalemia. Then the renin rule, followed by normal BP and hypokalemia. And finally, the pheochromocytoma exception.
Let's start with Section 1, the blood pressure divide, which is our primary branch point.
Okay, so here's the crucial first step. When you see a low potassium lab value, your very next thought needs to be a bifurcation based on blood pressure. Are they hypertensive or are they normotensive? Don't even look at anything else yet. You take all the potential causes of hypokalemia, slice them right down the middle, and you've instantly eliminated half the possibilities. It's a total game changer for streamlining your focus.
Moving right along to Section 2, high blood pressure and hypokalemia, looking at 3 specific causes.
For hypertensive patients, there are 3 specific causes you need to know, and you can easily lock them in using this wonderfully punchy mnemonic: Conin, crush, rash. I love this because it sounds almost like an action sequence in a comic book, right? Conin, crush, rash. Say it a few times in your head. It's incredibly sticky, and it perfectly encapsulates the 3 distinct hypertensive pathways we're looking for.
Let's break that down. The first part is CON, which stands for Conn syndrome, also known as primary hyperaldosteronism. That's your first C. Whenever you think of the word Conn in this memory palace we're building, you instantly link it straight to Conn syndrome.
Next up, crush. This represents our second hypertensive cause, Cushing syndrome. The mental imagery here is fantastic. Just picture the high blood pressure literally crushing down on the patient. It gives you a direct, unforgettable link to Cushing syndrome. So now we have Conin for Con and crush for Cushing.
And finally, rash. This perfectly locks in RAS, which stands for renal artery stenosis. Conin, crush, rash. Conn syndrome, Cushing syndrome, and renal artery stenosis. You've got 3 incredibly complex medical conditions instantly categorized by 3 simple words. That is the power of organized visual learning.
Section 3, the renin rule, and how it helps differentiate these causes.
Here's where it gets really elegant. How do you tell them apart on a micro level? You use the renin differentiator. RAS is raised, meaning a raise in renin, while Con is closed, meaning low in renin. It's brilliant because the letters do the heavy lifting for you. In renal artery stenosis, or RAS, both start with an R. RAS means renin is raised. On the flip side, Conn syndrome starts with a C. Con means renin is closed, or low. Raised for RAS, closed for Con. No vague guessing, you just rely on the first letter of the condition.
Pivoting now to Section 4, normal blood pressure and hypokalemia and the simpler causes.
Now, if you have hypokalemia, but the patient is normotensive, the causes are actually beautifully simple: diuretics, nausea and vomiting, and Gittleman syndrome. Notice how much less aggressive this list feels compared to our hypertensive side? It's straightforward. A patient might simply be losing potassium through diuretics, or maybe from severe nausea and vomiting. And then Gittleman syndrome rounds out our normal blood pressure branch. By keeping this side of the map completely separate from your con and crush, rash side, you prevent everything from blending together.
Finally, Section 5, the pheochromocytoma exception.
Frameworks and rules are fantastic, but you absolutely have to know the exceptions so you don't get tripped up in a real-world clinical scenario. The major caveat to keep in mind here: in pheochromocytoma, the potassium level is actually going to be normal. Despite whatever else might be going on or whatever hypertension you might see with a pheochromocytoma patient, the potassium does not drop. Knowing this exception is absolutely crucial because it proves the rule and it stops you from chasing a hypokalemia diagnosis where one literally doesn't exist.
All right, quick pop quiz to cement this into your long-term memory for the wards. What exactly did rash stand for in our Conon, crush, rash sequence? Take a second. Visualize that hypertensive branch. Think of the R and the raised renin. Yep, renal artery stenosis. If you nailed that, you've successfully mapped this entire clinical pathway today. But I want to leave you with this final thought. In a high-stakes emergency,
A misdiagnosed electrolyte imbalance can be fatal. If a simple mental map like con, crush, rash can save you precious minutes of diagnostic time, what other outdated flashcards in your brain are putting your clinical efficiency at risk? Keep learning, keep structuring your knowledge, and we'll see you in the next explainer.